Problem of youth gang affiliation in the United States is a significant psychosocial problem. 2 out of 5 total gang members in the United States are under the age of 18, according to the National Gang Center. 8% of all youth between the ages of 12 and 17 are involved in gangs. And according to the CDC, this comes at a cost of $215 billion annually to the United States, imposing a strain on already disadvantaged communities. Youth gang affiliation, of course, is a very significant social problem in that it affects communities that are largely urban and majority minority. Even in the New York Times 2 days ago, there was an article explaining that even here in New York City and East Harlem, there has been youth gang warfare affecting mostly 16-year-olds, rival gangs engaging in gang warfare. It's a local problem even. Youth that are involved in gangs are more likely to not only commit violent crime, but become victims of such crimes themselves. Aggression, hypermasculinity, inter-gang conflict, involvement in illicit activity, unprotected sex, substance abuse are all part of the lifestyle, according to the routine activities theory, which posits that the nature of gang activity inherently exposes members to increased violence, as well as increased risk of various forms of trauma-related mental illness, such as anxiety, depression, psychosis, which leads to cumulative disadvantage throughout the lifespan as members struggle to attain meaningful employment and educational opportunities. Now, not all members of gangs that become involved as youth are created equal, so to speak. Moffat posits the dual taxonomy theory, which says that as people become involved in delinquent activities as adolescents, there are really 2 trajectories. There are those that sort of just become involved for social reasons, whether it's to appear cool, or they are just seeking that sense of belonging or to question authority. But they do so really without a developmental context, and after the adolescent years, they don't show a persistent pattern of such behavior. Those are the adolescent limited offenders. The bigger problem, of course, are the life course persistent offenders. These are those offenders, those gang members who have that record, that history of neuropsychological distress as children, learning disabilities, ADHD, behavioral disorders, and they will have a lifetime of delinquent behavior and gang membership. So to look at those individual factors, we'll delve now into some of the psychological theories, the first being personality theory. So when we speak of personality, we're talking about those sort of innate, stable, enduring aspects of one's behavior and thoughts across different situations. The most enduring and widely accepted model of personality today is the 5-factor model, where we look at openness, conscientiousness, extroversion, agreeableness, neuroticism. And among these traits, we see that among gang members, they tend to be low in conscientiousness, agreeableness, high in neuroticism. And this is correlated with increased aggression, mental distress, antisocial behavior. Members of gangs tend to be very assertive, dominant, highly self-confident, even narcissistic, grandiose, which is associated with psychopathy, greater impulsivity, greater moral disengagement, and a lack of empathy, which are even traits that are associated with all gang members. Gang members in general tend to have greater rates of diagnosis of antisocial personality disorder, lower rates of empathy, and lower rates of emotional intelligence. Taking a more developmental approach, we could look at attachment theory. John Bowlby looked at attachment, the quality of bonds that are forged between infants and their primary caregivers, their mothers, their fathers, typically in infancy. Bowlby believed that if you looked at the quality of the attachment bonds, this will be predictive of the nature of later interpersonal relationships. Secure attachment would result in children who would later have, quality, stable, firm relationships, while also exhibiting autonomy. Children, on the other hand, who did not trust their parents, they had avoidant, anxious, or even disorganized attachment, they would later fail to show concern for others. They would have low empathy. They would not show affection for others. Such poor attachment would be associated with aggressive or delinquent behavior. And those would be the children that would grow up to be vulnerable to join gangs as adolescents. Recent research would indicate that these are those individuals who would look towards gangs to fill that void, for safety and belonging. That when secure attachments with parents are lacking, the gang would sort of fill that need as a surrogate family unit. Looking at neurological evidence, why is adolescence such a critical period? Adolescence is a period in which teenagers, of course, tend to engage in risky behaviors like getting involved in gangs because there is an imbalance in maturity. The socio-emotional and self-regulation systems develop at different rates. So the prefrontal cortex, which is involved in impulse control and reasoning, remains underdeveloped, whereas the limbic system, which is involved in risk-taking, peer acceptance, groupthink, reward-seeking, that is developed. So adolescence, the adolescent brain, is developed for the risk-taking behaviors, underdeveloped for reasoning. At the same time, this is a critical period in which adolescents are especially vulnerable to the onset of mood disorders like depression and bipolar, because there is increased plasticity in the prefrontal cortex as well as synaptic pruning. Without there being adequate parental support and access to mental health services, adolescents suffering with these disorders will seek relief within gangs. Very recent research from Suarez also shows that when teenagers are exposed to violence in the home or in the community, this leads to increased amygdala reactivity. That reactivity leads to reductions in gray matter in the prefrontal cortex and hippocampus, which again will increase the impulsivity. This also results in poor academic performance. This impairs judgment even further, reduces intelligence even further, amplifying those effects of the adolescent brain, making youth even more vulnerable to gang affiliation. If we go back even more in terms of childhood, or even what happens in utero, we have exposure to teratogens, pollution. If the mother or even the father are involved in taking drugs, tobacco, alcohol, exposure to pollution, poor maternal nutrition, lack of folic acid, marijuana use, even maternal depression or mental illness or use of psychiatric drugs, these are all associated with the onset of behavioral and learning disorders in children, including ADD, ADHD, oppositional defiant disorder, and conduct disorder. McFarlane demonstrates that conduct disorder is associated with a 40% greater likelihood of the onset of antisocial personality disorder in adolescence, greater impulsivity, aggression, deviance, all behaviors associated with gang activity. So we're looking at impulsivity, hyperactivity, and attentive behaviors. These make it very difficult not only for youth to perform academically, but to form friendships. Rejection, isolation from peers make youth more susceptible to seeking that sense of belonging and social identity within the gang. Moving on to some social factors. If we look at psychosocial development according to Erikson's theory, identity versus role confusion is what marks adolescence. So in adolescence, we seek belonging, we seek to create meaningful relationships with other people, a sense of belonging. And when teenagers don't have the space to safely explore a sense of identity without feeling pressure and a sense of conformity, they feel insecure, confused, even rebellious, unsure about their place in the world, what their values are, aimless about where they're going in life. They struggle to identify a purpose or path. And when that's lacking, the gangs are very often right there to provide that sense of identity, a firm role, a sense of purpose and belonging, values, even providing culture, external identifiers, a language, an attire, an image, codes, a culture that's tied to identity itself. That ties very closely to social identity theory. Teichfeld and Turner posit that a person's membership in a social group, it contributes to their self-concept. And the groups that you belong to are an important sense of your sense of self, your self-esteem. You adopt a group identity. You see yourself in terms of that group's values, beliefs, and norms. You conform to what a good member of that group is. You compare yourself to others, leading to in-group versus out-group comparisons, us versus them thinking. You conceive of yourself as a member of the gang. It gives you a total sense of who you are. And this is really what leads to very strong senses of prejudice, sort of in a broader sense, racial, religious prejudice, but in terms of gangs. When youth get involved in gangs, this is what leads to sort of that gang warfare that we see in the news. Intergang violence. You must defend the gang, the in-group identity, from rival out-groups. And that sense of social identity is what leads gang members who think of themselves, they define themselves in terms of the group identity. You're a prototype, you're a member of the gang, you're not really an individual. That de-individuation, that depersonalization of members of other gangs is what leads to that gang warfare. If we consider, sort of pathways to the gang membership, if we consider sort of what goes on in the street culture, a very good explanation of that is sort of observational learning, the social learning theory, Bandura, right? Bandura very famously, the child sees somebody punching the Bobo doll, the child repeats the action. People observe, model, and imitate behaviors they see other people doing. And when behaviors are perceived as being rewarded, they're going to be imitated and repeated. People growing up in very rough and tough communities, when they see people in gangs, they see these behaviors as honorable, rewarded, offering safety, prosperity. Gang members are seen as being taken care of, especially in areas where there's no protection otherwise. This will result in those behaviors being imitated, often out of necessity and survival needs. The necessities of daily life, making ends meet through whatever means necessary, protection, will render gang members, especially leaders, being seen as social models. And young people learn to replicate their behaviors through observation. They become objects of identification, and their behaviors seem relevant and attainable. Young people believe that they too can become those gang members, and it's a desirable thing. Festinger also gives a social comparison theory. People compare themselves to others. They evaluate their attitudes and abilities relative to those judged to be better off. That's the upward social comparison. It used to generally be believed that, people would develop sort of like an inferiority complex by comparing themselves to those better off, upward social comparison. What happens now is we see that when people engage in upward social comparison, it sort of leads to an aspirational effect. They aspire to the status perceived to be held by those who are better off than themselves, an assimilation effect, we would call that. And in these areas where people engage in social learning, there is that sort of assimilation effect where people aspire to be gangsters because it is seen as a status better than what is available to them. The gangsters are seen to be entrepreneurial, gallant strongmen who are not victims. It is the better option to being deprived and being victimized and isolated and on your own. So it is a function of upward social comparison. Travis Hershey also posits social control theory, that if we look at the nature of sort of disadvantaged communities in America, People do not feel bonded or committed to social institutions that traditionally are understood to maintain order, whether it be the family, right? Families are in crisis, families are broken, houses of worship such as churches, mosques, temples, schools. There's very little faith or trust in the police in these communities, which we understand due to, racism and so forth that affect the police departments. The less an individual feels bonded to societal institutions, the more likely they are to affiliate with gangs, which take the role of a social institution that people can trust. So people can trust a gang. They can't trust societal institutions. So that social disorganization, um, leaves a vacuum that the gang fills. And so it is just a function of societal disadvantage that the gang is filling. Now, if we look at different interventions, um, we could see really what can be done. So the first that we will look at are anti-bullying programs. So Shelley and White explained that victims of bullying actually exhibit the highest levels of risk of joining gangs. When people are victims of bullying, especially in school, the gang offers them protection that the schools very often do not provide. On the middle school level, they explain teachers very often are not really adept at identifying who is a bullying victim, and the schools often are very ineffective at offering protection to students. So we need to offer mental health support. We need to offer better training to teachers to be able to address these fundamental needs of safety, because unfortunately students do not feel safe in school. And one successful intervention in Indonesia that BOSE identifies is sort of a peer support program where teachers provide mentoring to student leaders who develop programs in which bullying can be addressed. Offering parental support in the form of attachment and biobehavioral catch-up and child-parent psychotherapy. These are programs that help parents form more secure bonding with children, even up to the adolescent level. The more firm bonds we develop between parents and children, the better, the better supported the better supported children will feel. The closer to their parents they'll feel, less likely they'll turn to gangs. Children who are at risk would also benefit from CBT, cognitive behavioral therapy, to address those distortions of cognition, such as poor self-control, a fatalistic worldview. CBT addresses those distortions by helping children develop better goal setting, moral reasoning, critical thinking, and so forth. Functional family therapy. Children who are at risk of gangs, again, by forming better bonds between children and the family, reaching the family where they're at, developing those bonds, better peer relations, better self-esteem, we reduce the likelihood of children succumbing to gang affiliation. Utilizing the media, very novel approach. Sort of gangster rap has a bad reputation for glorifying violence, gang affiliation. We have research that shows that rap music can also be utilized for pro-social aims, such as encouraging pro-social behavior. So it's very controversial, the idea that things like video games can encourage violence and aggression. We do have research from Hahn that shows that youth exposed to a high degree of media violence, they do show greater levels of proactive aggression and higher levels of reactive aggression. So we want to address that exposure. And lastly, mentoring. We could utilize mentoring. Mentors who have been especially gang exposed can offer very, very good pro-social activities to youth who are at risk. They could be a very firm presence in the lives of at-risk youth, offering an alternative. It's either mentorship or the gangs. And lastly, for youth who may not be the most academically inclined, opportunities provision, offering such youth the opportunity to have vocational training, the opportunity to make money in an honest way, the opportunity to have access to job formation and vocational programs would get them off the streets and give them the opportunity to earn money in an honest way within a mentoring capacity also. Thank you.